Here's the deal on these vaccines. The mRNA technology used by Pfizer and Moderna for COVID-19 vaccines is not new. This technology has actually been around for decades when scientists at the University of Pennsylvania first studied it. One big problem they found back then was that mRNA was not very stable. It broke down quickly in the body. They knew more research was needed and that it would take time. Over the last several decades, mRNA vaccines were studied for flu, Zika, rabies, and other diseases. There wasn't an overwhelming success for the vaccine in preventing those diseases. Plus, those diseases already had pretty good vaccines, so they tabled it. The DNA technology that Johnson & Johnson used for their COVID vaccine is also used for their Ebola vaccine, which is already approved in Europe. So, COVID-19 came on the scene in 2019, and we saw how easily and quickly the disease spread. With the number of people around the world who were getting sick and dying, scientists went in the lab to find a vaccine that could work. Countries around the world put their resources together so that scientists could easily collaborate, share ideas, and come up with vaccine options more quickly than the regular process of drug development. They did not cut any corners. They simply worked smarter. Various companies around the world explored different vaccine options. Many of them failed. For the US, several companies explored the same mRNA technology that was first discovered decades ago at Penn. In fact, an African-American scientist, Dr. Kizzy Corbett, led the research team that helped discover one of the COVID-19 vaccines. African-American scientists and healthcare professionals helped to design and run some of the clinical trials. Speaking of African-Americans, the 4 HBCU medical schools, Morehouse, Howard, Charles Drew, and Meharry, participated in COVID-19 clinical trials. In fact, globally, Pfizer included almost 4,000 Black people in their clinical trials, and Johnson & Johnson included over 8,500 Black people in their clinical trials. In the US, Moderna included about 2,500 Black people in their trials. We showed up and showed out. There were over 115,000 people worldwide who volunteered for the clinical trials, and there were no serious side effects found. That's impressive. Now, there have been a small number of serious side effects after the vaccine became available to the general public. But even still, the number is really small, so the chances of it happening are low, even lower than the chance of getting struck by lightning. One good thing to know about vaccines is that if an adverse reaction was to occur, it would most likely happen within 2 months of getting the shot. Many people received their COVID-19 shot well over 2 months ago, and they are making out just fine. Plus, for vaccines, healthcare providers don't see side effects pop up years later like with other drugs. This lets us know the COVID-19 vaccine is overwhelmingly safe. Actually, it's probably safer than some of the foods we eat. Positive cases, hospital admissions, and deaths are way down for people who have been vaccinated. The vaccines are working. Thanks to Dr. Corbett and all the other researchers, the clinical trial volunteers, and everyone who worked on these vaccines, less people are getting sick and dying from COVID-19. Right now, the vaccines are all we have to help us get through this. Please do not go unprotected. Get your COVID-19 vaccine. If you have questions or to find a vaccine clinic near you, please visit delcopa.gov/COVID. This was brought to you by the Foundation for Delaware County.